More than 25 million Americans, 1 in 14, suffer from asthma, a disease that makes it hard to breathe and kills 10 people in this country each and every day. Here's how innovative technology linked to an inhaler is helping citizens manage their asthma in one typical American city.
Under 3 minutes.
Yes. I need my thing, Mom. My name is Mason. I am 9, and I live in Louisville, Kentucky.
1, 2, 3, 4, 5.
Louisville, Kentucky is one of America's asthma hotspots. 13% of the city's population suffers from the disease.
It feels like an elephant is sitting on my chest.
You feel chest tightness, your heart hurts, even though it's not a heart attack, but you feel it because there's just your body, basically, everything's rushing to try and get you to breathe.
So Louisville's air quality has been a challenge for a very long time. We typically make it to the tops of lists that people don't want to be on the tops of. So, the 4th highest rate of asthma nationally, one of the 10 worst places to live if you have breathing disorders, and allergies. I mean, we've looked at some of these lists and the people that make them and said, our goal is to get off your list.
One of the first calls Ted Smith made was to David Van Sickle, CEO of Propeller Health.
Every year in the United States, asthma still causes millions of emergency room visits and hospitalizations.
Van Sickle's company was developing a sensor to track the inhaler use of asthma patients. He came up with the idea after studying a mysterious asthma outbreak in Barcelona in the 1980s.
There's a classic study from Barcelona, Spain, where it took about 10 years for a team of expert physicians and scientists and public health officials to understand that these significant outbreaks of asthma that were occurring and sending lots of people to the hospital and were caused by a lack of appropriate filters in harbor silos. They put on a map for the first time the locations where people's attacks had begun. It was really the first time that an asthmagen like that had been identified that was causing these community-wide outbreaks of pretty severe disease.
The challenge? How to track community asthma attacks in real time. The answer? A sensor small enough to fit in your pocket and able to connect to a smartphone and upload data.
We had this idea that chips and sensors and radios had become small and cheap enough that they could now be, actually physically built into the medications that people take.
It took a couple of tries and a few clunky prototypes, but Propeller's current sensor fits seamlessly on top of a typical inhaler.
So the Propeller sensor is this device. It attaches to a patient's existing medication and then passively tracks when the medicine is used and sends that information on to a smartphone.
Richmond?
In 2012, the city of Louisville partnered with Propeller to begin distributing these sensors to its citizens. Dawn Sirik is one of them.
If you're a non-asthmatic, then you don't have to think about breathing. When you're an asthmatic, breathing is exhausting. It can be all that I can do some days is breathe. This is what asthma means to me. I do this inhaler twice a day, this inhaler twice a day, this inhaler twice a day, and then this inhaler as needed. I track all of these medicines with the Propeller app on my iPhone. Every time I use my inhaler, it sends a signal to the app and it logs it for me. It gives me all kinds of details. It tells me how many days in the last month that I've had symptoms, how many times I've used my rescue inhaler this week. It tells me the last several months how compliant I've been with my daily meds.
It lets you see a trend of how the patient is doing. It allows us to outreach to the patient to kind of see what is going on. Is there an issue that we can catch prior to them getting to that point and making it to the ER?
Dr. James Sublett is director of Louisville's largest asthma center.
Okay, I see how you're doing here. The big benefit I see is we get proactively the reports of people who are needing some intervention.
Prevention is especially important to Dawn because she sees a lot of asthma cases as a pediatric nurse at Louisville's Cosaire Children's Hospital.
We're getting into respiratory season where most of our kids are respiratory kids. Kids with asthma come in and they can't breathe. You have to have somebody at your bedside all the time. You take a lot of resources. It's very serious. Well, I think the sensors are going to revolutionize asthma treatment. It's helped me figure out what my triggers are, because I had no idea 6 months ago what my triggers were.
I've come to rely on using the sensor. It's on the main inhaler that I keep with me. It's helpful because it does track. It tracks all of it. I can go in and it shows me a map of exactly where I was when I used the inhaler. I can go in and put my triggers, that it was exercise, and then symptoms I had. It shows me a sad face because it says asthma is not well controlled. So I've been using it for a lot of strenuous activity, exercise. But the orange is the days that I've used it over the last week. It's really nice to be able to see the data, to know instead of just trusting your instincts or your gut, that you can pull that information out and you can graph it and you can plot it and you can play with it.
We can, over time, build up a picture of why they're having symptoms, when and where they are, and hopefully be there as a, as a companion to help unravel this mystery of what's causing their asthma to worsen when it does.
Yeah, it actually puts my mind at ease when he's not with me. I'll know whether or not his asthma is acting up when he comes back to me regardless. Because if it is, then I'll know I need to go ahead and make this appointment, get him on some steroid medications or whatever.
The data is used for more than diagnosing an individual's symptoms.
Where people use their rescue medications, their inhalers, is really an important marker of what's happening in the community. There's lots of small area spatial and temporal variation in what's happening with asthma, but we've never been able to capture it because we've never looked, right? It's never been visible before.
Applying the same insights gained from studying the Barcelona outbreak, Van Sickle and his team hope this data can be used to identify asthma hotspots all across the city.
So we have, with this citizen science project and with this citizen collected data, we have access to data that's never ever been available before. And so we can look for patterns of asthma across the region and then do analyses to try to figure out what might be driving those attacks. And so it'll really give us a great picture into what's going on in Jefferson County. We did find significant clusters. We can see a cluster in the sort of southwest area, a cluster over downtown. Interestingly, we saw a cluster that was just east of downtown, which is in a more affluent area, which was something that was very unexpected.
They'd expected most asthma attacks would be triggered by industrial sources, but it turned out wind direction could move pollution to areas with no such sites.
I think that it's good that we're all connected. We all have the same sensor that goes to one central location. So the data all is being pulled from different people. So they could live in West Louisville, East Louisville, South Louisville, downtown, even some in Southern Indiana. If 50 people all use their inhaler within 20 minutes, if they all look like they're in the same location, say like Thunder over Louisville, okay, maybe fireworks aren't the best thing for asthma. Maybe we're gonna recommend that you don't go to the river and watch the fireworks. Or if you do, you take more precaution because it seemed like everybody in the city was using their inhaler at that time.
We look to programs like this as this are the things that we need to do in our community to change the statistics for these diseases here. We will get the economic benefit. We will get fewer ER admissions. We will get more productive days in the workplace. But more importantly, we'll get a place where people want to live.